Zach Green is with PTCB, Pharmacy Technician Certification Board. I've said this so many times, but to me, Zach is the face of PTCB. And what a wonderful face, not just because he's handsome, but because he really represents and encompasses the heart of PTCB. He has not missed a convention presenting for us. Maybe there was one, but another PTCB person came in his place. And he lives in Florida, right? But PTCB is based out of DC. And so if you can please help me in welcoming Zach. Can you guys hear Zach?
Can you hear it out of this? Or, okay.
Can you guys hear it back there? Okay, they're saying
This one?
yes.
Yeah? Okay, cool. The next. Oh, there we go. Okay.
Nope, you're good.
All right, sweet. All right, so my presentation today, thank you, is Guardians of Medication Safety, Understanding the Regulations and Responsibilities Shaping Pharmacy Technicians' Impact. So I feel like Terry's presentation was a really good setup for this one. So excellent setting up the schedule this way, because we'll go a little bit deeper into some things that she was talking about. My disclosures, I'm employed by PTCB, as you know, that's all I have to disclose. Our learning objectives, they're also in the notebooks there, so I won't read each of the bullets to you, but this is what we'll be going over during the presentation. I do want to start off with, basically with any presentation, I always like to take a snapshot of the current practice of pharmacy technicians, what we are doing as pharmacy technicians, and what the landscape looks like, because as I saw with the raise of hands earlier, not everybody's from a single state, and there are no two states that are alike. So it's good to talk about what the current practice looks like. According to the Bureau of Labor Statistics, there are 459, almost 460,000 pharmacy technicians that help pharmacists dispense prescription medication to customers or health professionals, which is an extremely vague definition of what pharmacy technicians do. I know Terry, in the previous presentation had an example of a sentence of what a profession is, and then used Nebraska as an example of what a really long description of that same thing is. And I feel like on a national level, it got even smaller for this. So there are, as I said, 460,000 pharmacy technicians roughly in the United States. The average wage is $37,900 per year, or $18.17 per hour. This is a slight increase from 2021 numbers. That was $17.66 an hour and about $36,000 a year. And then this last number here, 44,900, that's how many job openings there are expected to be for pharmacy technicians. And this is the Bureau of Labor Statistics is expecting a 6% increase over the decade. So over the next 10 years, this is a growth projection from the BLS. This actually has decreased over time, which is interesting because we're all very familiar with the shortage that we're all hearing about. Does anybody have no issue with pharmacy technician shortage or even pharmacist shortage? Is everybody fully staffed? No. Yeah? Oh, there are some yes. Yeah, it's difficult. It's, entering the pharmacy profession, whether you're a pharmacy technician or a pharmacist, it's needed right now in pretty much every community across the United States. So I find that it's interesting that this projection is going down. Last year when I used these numbers, I think it was 10%, and a couple years before that, it was probably 15%, and even earlier, it was at 20%. So it's really interesting to see where these numbers will go. This is an example of all the points of entry for pharmacy technicians. So there was a question earlier about having to do two things, I think, yeah. So the difference between registration, certification, licensure, what does all of that mean, and how come there are so many ways to enter the profession? There's no national standard to work as a pharmacy technician, so that means that all 50 states and all the territories get to make their own rules for pharmacy technicians. So there's board regulation, that's registration, licensure, and certification. So the difference between these two, and oftentimes they're used interchangeably, but they all are very different meaning. They all have different meanings. Registration, if you think about it from a simple definition, is simply having your name put on a registry. You're a list. So a state board has a list of who is working as a pharmacy technician. Now that's a very generic example. There's often a lot more that comes with just putting your name on a list, like a background check, fingerprints, and things like that. Sometimes a fee, usually a fee, and then in order to stay on that list, there are, each state has reasons for how you can stay on that list, or why you should stay on that list, or why you should not stay on that list. Oftentimes that's CE, earning continuing education. That works in some places to maintain your registration with your state board. It also works with maintaining your certification. It also sometimes works with maintaining your licensure. Regarding licensure, that is usually, if you look at the definition of licensure, that is an authoritative body that determines some rules in order to allow an individual to practice as a professional. So usually when you think of licensure, you think of a physician, a licensed physician, or a licensed nurse or a nursing assistant. In pharmacy, we typically see the pharmacist is licensed, but the pharmacy technicians are registered. However, we do see where states license pharmacy technicians. Is anybody here considered a licensed pharmacy technician? Yeah. Yeah, excellent. So that is good. I think licensure is a step up from registration, because if you think of it, it's a little bit more than just being put on a list. And then there's certification. That is basically passing an exam that identifies that you have successfully completed and understand all the knowledge that's required to be a pharmacy technician in this example. Another way to enter the workforce is employer training. So in some states, like Terry mentioned, in Delaware and Hawaii, there are no regulations for pharmacy technicians. So there are best practices put in place where employers train individuals and determine on an interview process who they should hire. Because in those states, there's not even a registration process, there's no licensure process. So what happens if I work in Hawaii as a pharmacy technician, as a wonderful example to be working in Hawaii, and I steal a bunch of prescription drugs, and I walk out of the pharmacy, nobody knows, there's no traceability, there's no board of pharmacy action taken on me, so I go down the block and I get hired at a second pharmacy, and I do the same thing, and I keep doing that until I exhaust all the pharmacies on the island. Right? What happens to me? Absolutely nothing, right? So you can see how this is dangerous, without registration or without licensure. At least with registration and licensure, they can be revoked, or some disciplinary action, can be put in place for varying things. And each of the states do have their laws and regulations for what disciplinary does. Then there's board-approved exams. There's the Pharmacy Technician Certification Exam, which is PTCB's certification exam. There's the EXCPT exam, that's the National Health Career Association Pharmacy Technician Certification Exam. Those both award the CPHT credential. They are two different organizations, two different exams, but the CPHT credential is still recognized in all 50 states by both exams. Then there's the state and employer exam. Nebraska is a good example of that. Nebraska has a state certification for pharmacy technicians. And then we're seeing very few of these employer exams, but in the early days when pharmacy technicians were just beginning to be registered within states, before licensure was really around for pharmacy technicians, some employers would create their own certification exams and say, here, Board of Pharmacy, we've certified these folks as pharmacy technicians. They're authorized to work for us. Those are going away. It's really hard for a board to maintain the accuracy of what you're testing your technicians on, especially when there are organizations out there developing formalized certification exams that the Board of Pharmacy could rely on. And then finally, did somebody have a question? Yeah.
Those who took the state exam, are they grandfathered in? Because I know
It depends on the Board of Pharmacy.
Got it.
Yeah. Speaking from PTCB's point of view, there is no grandfathering in of if you have a state certification. like you automatically get a PTCB certification. But for example, I'll use Michigan as an example. Is anybody here from Michigan? Yeah, excellent. So Michigan has a large employer, Meyer Pharmacy, and Rite Aid. I'm sure Rite Aid's national, but they both had employer certification exams. And when Michigan said, we're going to license or register our pharmacy technicians, you have to pass a national certification exam. However, if you passed one of these other exams, we can go ahead and process that, but we encourage your pharmacy technicians to take a national certification exam. But it really, that way it turns that to the individual technician to say, do I want to get it in like my own personal national certification that might be transferable? Or if I've been working as a technician for 30 years and I was certified by Meyer, I don't know. Yeah, I don't know if I need my national certification. I'm not going anywhere. And then lastly is formal education. So did anybody here go to a formal pharmacy technician training and education program and said, I want to become a pharmacy technician? Yes. Yeah, excellent. That's awesome to see. I accidentally found a career as a pharmacy technician, and I think most of us could agree that that is the same scenario. We're seeing formalized education, even though it's existed for a long time, even since before PTCB was founded in 1995. ASHP was accrediting, that's the American Society of Health System Pharmacists. They were accrediting pharmacy technician training programs in the 80s, early 80s. But now we're starting to see health science tracks in high school attract students who excel in health sciences and math, and not everybody's cut out to be a pharmacist, right? Like you can make an excellent career as a pharmacy technician now. So we're starting to see this formalized, formal education entry for pharmacy technicians grow, which is great. I talked a little bit about accredited programs, how they've been around for a long time, but there are non-accredited training programs out there as well, especially in the high school. Like, I think it's great to introduce career opportunities at a high school level whenever you're learning about different careers, health careers, and pharmacy technician, because it's so accessible. Like, I think the one common thing outside of Hawaii and Delaware is there's an age requirement. There are a couple of states that allow 16-year-olds to work as pharmacy technicians. So, you could work in high school as a pharmacy technician. A lot of times it is 18, but most folks turn 18 either during high school or right after high school. So you could leave high school with basically and enter the workforce, which is excellent. I do want to point out that the accredited programs, this used to be kind of trending toward requiring this in order to, get registered with the State Board of Pharmacy or licensed with the State Board of Pharmacy. You would have to complete an ASHP or ACP accredited training program for pharmacy technicians. There are a few states that are doing this. North Dakota has done it for a long time. Anybody here from North Dakota? Usually one or two, no? So North Dakota requires, yeah.
Illinois does it now.
Yeah, I was just going to say Illinois, it just implemented laws or the regulations for pharmacy technicians. They have to complete an ASHP accredited training program. Louisiana has done it for quite some time, and Virginia is also moving toward that as well. So there are about 260 around the country that are accredited training programs. So you can see the accessibility of that type of education isn't really there yet to have like a national standard, but I do think that at some point, like accredited training, like pharmacists go through an accredited training program, pharmacy technicians should have some type of standardized, pathway to enter the workforce, so there's not all of this. But I will say that this is kind of beneficial too in some places, right? Like, how else would I have accidentally found becoming a pharmacy technician if I didn't get trained by my employer, So, regulatory update, there's a lot of numbers on this slide. So there are 49 states that require, or 49 states and territories that register or license pharmacy technicians. So I mentioned 2 states that do not have any, Delaware and Hawaii. So you notice I say state and territory because DC is a territory, it's not a state. But they do require registration for pharmacy technicians. Only 17 states require national certification. This is, when I was talking about certification and licensure, national certification is often a pathway to meet those requirements. So Texas, for example, if you get nationally certified, you basically automatically become registered with the State Board of Pharmacy. And then if you maintain your national certification, you won't have to get audited because the State Board of Pharmacy is relying on PTCB to do their due diligence on maintaining the certification of that individual. So it kind of works out that certification works in favor in that state, but not all states are the same. This next one is really interesting. Is anybody here on the Board of Pharmacy in your state? I don't think so. So there are 17 states. Well, that's out of date now. There are 18 states that have put in their rules and regulations to have a pharmacy technician seat on the Board of Pharmacy. And I think this is incredible. Obviously, we're working as pharmacy technicians alongside pharmacists, so why not have a voice in the regulatory process, right? So when I started at PTCB in 2013, this number was 4 or 5, I think. So in 10 years, to jump to 18, it's moving relatively quickly. Let's see. Technician product verification. This otherwise is known as Tech Check Tech, which is too difficult to say. So technician product verification we're moving toward. Or even easier is TPV, because pharmacy needs another acronym. But it's great. Technician product verification, when it first came out, actually was in the 70s, that technicians were checking the work of other technicians in the health system setting. And this is like, for cart fill and things like that, where a pharmacist has already checked it before it went on the shelf. So, making sure a technician checking the work of another technician by filling that order, and then the nurse is the ultimate final check before it's delivered to the patient. So 23 states allow technician product verification. This is across the board majority health system. They limit it to health system pharmacy technicians, but we are moving to see more community acceptance and allowance of technician product verification in the community setting. Iowa, for example, anybody from Iowa here? Yeah, excellent. So Iowa allows community technician product verification. And I'll talk a little bit more about technician product verification later in the presentation. Then immunization administration is allowed. So right now, under the PrEP Act, all 50 states and territories allow pharmacy technicians to administer COVID vaccinations. That is a national standard that does exist for pharmacy technicians. You have to be certified, you have to be trained to be an immunizer, but it is allowed. It's not required at all. Is anybody here an immunizing technician? Excellent. That's great.
And in my state, prior to that, with them rolling out the actual certification for it, I know specifically in Georgia, they opened it up for COVID.
Yeah.
So we were doing that through the AAPT.
Yeah.
And then it rolled out to be the immunization. Do we have to go back and take that test?
If you want to. Are you talking about the PTCB assessment-based certificate? Yeah, if you want to. Yeah, you can. Yeah, and I'll talk a little bit about that pathway in a few slides here. But so Idaho was the very first state to allow pharmacy technicians to immunize, and this is prior to COVID happening. This conversation happened in 2017, and everybody's mind was blown that they would think to even allow pharmacy technicians to administer vaccination. Fast forward now, look what happened. Unfortunately, the COVID pandemic was really terrible, but the silver lining, and we have to look at that, I think it's really accelerated our profession to accept pharmacy technicians to do more and allow pharmacy technicians to do more. So this number 39 represents states that have said beyond the PrEP Act expiration, we're going to allow pharmacy technicians to not only administer COVID vaccinations, but other vaccinations, which is great. They've seen the positive response from the workflow in pharmacy. So they've implemented these rules. And then there are 16 states that allow point of care testing. So this is obviously another very community focused regulation, but this number used to be 0. So it's really great to see that 16 states allow pharmacy technicians to do point of care testing. So certification, it's not one size fits all. Even though PTCB and NHA have national certifications, it's accepted in all 50 states. It can serve as a pathway to become registered or licensed. But it really is different for everybody. So once you're certified, there are different areas that pharmacy technicians can do once they are certified. So checking the work of other technicians, like we talked about, compounding. Believe it or not, there are states that you have to have a CPHT credential in order to do any type of compounding in the pharmacy. Transferring prescriptions. Some states don't even allow that at all for pharmacy technicians, but some states say that if you have certified pharmacy technicians, they're able to do that. And then accept call-ins, indirect versus direct supervision of other technicians or other pharmacy staff that aren't quite at the technician level, like they're just entry-level technicians working their way up to be certified, and then ratio variances. So an example I have here is in South Carolina, a supervising pharmacist can authorize a CPHT to receive and initiate verbal telephone orders and even conduct one-time prescription transfers, check technician's refill of medications if the medication is to be administered by another licensed healthcare professional in the institutional setting. And in Ohio and New Hampshire, in the community setting, only CPHTs can do sterile compounding, as I mentioned. And then Minnesota is a state that modifies the ratio if there are certified pharmacy technicians on staff. So how does all of this happen? It's not just like, let's just make rules change, right? Advocacy matters. And I think that number, if you think back to the State Board of Pharmacies, when I first started at PTCB 10 years ago, that number being low, and now we're at 18, which the slide says 17. But I want to use a couple examples of pharmacy technicians who have been champions at advocating for the profession. So the first one I'll talk about is Autumn Hawks. Autumn is a CPHT advanced, and she is the member of the Utah Board of Pharmacy, and she resides and works in Salt Lake City, Utah. So Autumn's board appointment is from 2019 to 2025. And she sums up the importance of finding a way to become engaged in pharmacy regulations. And I'm going to read this because these are Autumn's words instead of paraphrasing it for you. So Autumn says, "Get involved. In my state, all our Board of Pharmacy meetings are public and all are welcome. Make yourself heard. Your perspective is beneficial to everyone. Get involved at your local site. Join a committee or create one. Join a local state chapter of an organization. You'll gain a great perspective and build an incredible network of people. You may hear this is what we are doing at our workplace, and you can take that back to yours. There are so many great ideas out there. You need to find the people who have them." So I think this is really valuable. A lot of the let's include pharmacy technician on our Board of Pharmacy conversations happened because another technician heard about it happening. Right? So it really is a word of mouth. There are national meetings like National Association of Boards of Pharmacy that Terry was mentioning earlier. They have an annual convention, and technicians who are representing their states going to that meeting have invited other states just because they know that there are other technicians who don't have that opportunity to have a seat on their Board of Pharmacy. They go to this meeting and they learn of all these ideas, and then fast forward, it's like a snowball effect where, once 5 states allowed pharmacy technicians to be on the Board of Pharmacy, and now we have 18. So this is a very, very busy slide. But these are ways that pharmacy technicians, we as pharmacy technicians can advocate for ourselves and for our profession. So I'll start with site visits, and all of this sounds kind of overwhelming. Invite legislators to your site, plan a tour, and I'll skip actually over here too is office visits like state and national and pharmacy advocacy days, and then contacting your legislators. That sounds painful to me. Like I don't want to call a legislator. They have so many other things to focus on, but where you can find an excellent resource for this is pharmacy advocacy days. There are pharmacy days on the Hill. I don't know why this monitor went off. I think it went to sleep, I guess. I guess you can still see it.
We can.
That's weird. Okay. Anyway, so what's an excellent resource for this is your state pharmacy association and national pharmacy association. So you don't have to go to the Hill or go to your state capitol all by yourself. They have actual days for this. And I guarantee you, if you tell your employer you're interested in doing this, they will say thank you. Especially from a pharmacy technician perspective, because interns are almost required to do it as part of their pharmacy program. But getting involved with your national and state pharmacy associations is an excellent way to start all of this. And then the Be Present at Meetings section here, town halls. This is like political candidate town halls. If there's something you want to bring up, if you feel comfortable doing those types of things, that is one excellent way to do that, because the way regulations change is by people paying attention to it. And if a political candidate is paying attention to something that's happening in pharmacy, I guarantee you the Board of Pharmacy is like all ears, all eyes on that subject. And then, of course, being present at meetings, as in Autumn's example, the Board of Pharmacy, they're in every state, they're public. Not the entire meeting isn't always public. They do have closed sessions for like disciplinary things like that. But every state has public meetings, and you can check their website. And since COVID, you can, everything's virtual. So most states still have that virtual meeting option. So now I'll talk about advanced pharmacy technician roles. These are just a few examples, and obviously this list is not exhaustive. This list changes quite frequently. And if you've attended this meeting, you've seen this slide a number of times. And there are new things on here, and there are some things that have been removed. So in looking at these examples, is there anything that you might see missing? It's not really a quiz or anything like that. Just if you're working in in an advanced role that might not be represented on this list, let me know. I'll update it. Yeah. Yeah.
Clinical pharmacy coordinator specialist.
Oh, excellent. Yeah, we'll talk a little bit about that in a couple of slides here. Yeah.
Medication adherence. That's what I'll go with for now.
Okay. Yeah. No, those are both excellent examples. So now I'll use another example of with David Holmberg. And since this monitor is asleep, I think I'm going to have to read his quote here. But David works at a independent community pharmacy in Martha's Vineyard, Massachusetts. And David's advice for anybody is, don't stop doing your own research. Act as if you are a pharmacist and learn the regulations and rules they have to abide by. Sorry, let me say that. Act as if you are a pharmacist and learn the regulations and rules they have to abide by. When something new comes up, I always research it. I'm constantly reading things and updating my knowledge. You have to do that with regulatory compliance. Things can change on a daily basis. I think that's very wise advice. That's very sage advice. Acting as if you are the pharmacist for your knowledge, that ultimately helps you be a better intermediary, like going back to Terry's presentation. So David's journey, I don't have the notes on this monitor. I don't know why it went to sleep. Do you know? That's it. What's that? Yeah, do you mind? Sorry. Okay. And I can kind of read it there.
Yeah, that's
Okay.
so weird.
Yeah. That's weird. Okay. Anyway, so as I mentioned, David works as a CPHT at his family's community pharmacy at Martha's Vineyard. His father is a pharmacist, and so he's always been around pharmacy, but he really found value in earning CPHT Advanced. So he earned 4 assessment-based credentials, and then earned his CPHT Advanced and is maintaining that CPHT Advanced. Basically, he was looking to make a career out of being a CPHT. So this is where I wanted to talk a little bit about technician product verification. Sorry.
No, how inconvenient for you, and I apologize.
That's okay.
I was seeing if it got unplugged.
No, that's all right. Thank you for looking. Thanks. Sorry about that. So technician product verification, this is where I want to talk about the definition of TPV and the value of technician product verification. Generally defined as checking the work of other pharmacy personnel or automated systems, also known as tech. Studies have demonstrated that specially trained pharmacy technicians can perform this task as accurately as pharmacists, which should be no surprise to anyone, right? So I have talked about this study a number of times, but this is an abbreviated version of the key research findings, and you'll have access to the slides and the link to the actual research later on, or if you printed them out. But pharmacy technicians are accurate in checking refill prescriptions while helping pharmacists increase time providing patient care. And in 2 studies, pharmacies were able to implement 1 or more clinical services and increase pharmacist time spent on patient care after implementing technician product verification, which is great because in order to have the pharmacist practice at the top of their license, pharmacy technicians should be doing everything that they can to allow that, right? And that usually means picking up more or taking all of the distributive functions in the pharmacy. And that could mean checking the work of other technicians. Is anybody here a technician, product verifier, or checking the work of another technician? Excellent, yeah. So basically how this happened, it was in a state that allowed pharmacy technicians to do technician product verification in the health system setting. And they took folks from the health system setting and pilot it across 10 community pharmacies to see how they wanted to train other pharmacy technicians on the operation, how it could be effective in the community setting. That pilot was extremely successful. As you can see here, the top row is the pharmacist checking the initial work. So it's the prescription filled, product verification, the audit, and then the accuracy rate. So this was just the community. This isn't the actual work, or this is just the pilot. This isn't the actual workflow in the pharmacy. But in order to allow the Board of Pharmacy to allow this to happen, they had to obviously do a pilot and study all of this. So you'll see on the second row here is CPHT checks the work of another CPHT, and then the pharmacist does the final audit. And you can see the differences here. And you might not think that 99.95% is that much different than 99.99, but in pharmacy it is, right? Like that's a big difference. Next, I want to talk about Meredith Ayers. She goes by Merity, so I'm going to further reference her as Merity. She is also a CPHT Advanced. She works at an independent community pharmacy in Richmond, Virginia. Sorry, that's blurry. Wow, she cannot see that image. Sorry. So Merity's journey, she actually works, she's very involved with her community pharmacy. She's been in community pharmacy for quite some time. And then she's in rural, it says Richmond, Virginia, but she's in a very rural area. And I'm sure some of you could probably relate to this, where community health is, something that's very important to pharmacies. The patient population pharmacy technicians are the most accessible to these folks in rural areas. I mean, anywhere really, but in rural areas where Merity's journey began with immunization. So she and her pharmacist went out and did mobile immunization events instead of bringing the patients in. I think that's great, having community days at schools, libraries, and things like that. They even have a van now. It's like a really fancy van where they can go do immunization and other things. It's not just immunizations anymore, but it was brought on because of COVID, of course. So Merity has actually gone on to become an immunizer trainer. So part of that APHA training is you have to have like a certified trainer to train everybody else. So Merity has done that, and now she's implemented other community pharmacies in her area. The technicians come to her, to learn how to do that. And Merity is, in addition to earning her CPHT Advanced, has gone on and earned a community health worker certificate, which is a great cross-section for pharmacy technicians working in community setting. Community health workers responsible for many, many things. And I don't think it's a sole responsibility of pharmacy technician, but there are pharmacy technicians out there who are very capable of doing both. So immunization technician key data here are 2 studies. One from Idaho. As I mentioned, Idaho was the first state to allow pharmacy technicians even before COVID to administer vaccinations, 25,000 immunizations administered by pharmacy technicians, and there were 0 adverse events reported. In Ohio, I wish I could read the notes, but I don't know exactly what these percentages, hold on, I'm just gonna walk up there, is that okay?
You're on camera still up there.
It's okay.
Yeah, and you're
Can you
mic'd
still hear
up,
me?
so you're fine if you want to stay up
All
there.
right, sweet.
I'll advance for you.
Okay. Oh, no, it's all right.
Okay.
Yeah, so the Idaho study was done for 5 years. So it's between 2017 and now. I can't scroll the notes, but that's okay. I'll wing it. I won't make anything up. You have access to this. So basically what it comes down to is properly trained pharmacy technicians have the potential to increase the number of immunizations given and reduce the occurrence of vaccine-preventable diseases. It's important to note that pharmacists still perform the most appropriate role for their clinical expertise, and that is evaluating the appropriateness of the immunization for the patient. Furthermore, delegation of the technical task of immunization administration remains at the discretion of the supervising pharmacist in all states. So that is the one key thing that I wanted to point out there, is that it's great that pharmacy technicians are administering immunizations, but I do think that it's something that we should elect to do instead of be forced to do or be asked to do, right? It should be something you're interested in if you want to do it. I know that I don't think I could do it. I can stick an IV bag, but I'm not a person. Yeah.
So we have an online question in regards to immunization administration. It says, if you are a nurse or registered medical assistant that has given tons of immunizations, do you still have to go through certification for pharmacy setting?
Actually, I don't really know. I think that would be dependent on that specific board, because the board will probably have, like the nursing board will probably have their own rules. If that person is licensed or, as a nurse, they could probably act in that role. But I'm not too sure. The Board of Pharmacy would have a better answer for that individual.
I can do that.
Yeah?
Yeah.
You
I had to go through the certification to vaccinate as a pharmacy tech.
Because you were working as a pharmacy technician, you couldn't vaccinate as a nurse, even though you'd done it.
Depending on what you're working for or hired as. If you're hired as a pharmacy tech, you have to go through the certification.
Yeah, that's interesting. Makes sense. Sorry that you had to go through additional training, even though it was probably easy for you at least.
The difference is, as an RN, I was taught to aspirate. As a pharmacy technician, I don't aspirate.
Okay. So, all of this advocacy talk and allowing pharmacy technicians to do more and regulations changing and things like that, of course, employers care about business. So it is good for business for employers to be investing in pharmacy technicians. So I wanted to point out a couple of employers here. Bremo Pharmacy is where Merity Ayers works, and this is a quote by Catherine Carey. Our investment in technician development is an investment in the success of our pharmacy. Our commitment to investing in our technicians has not only enhanced our operational efficiency, but also contributed to positive workplace culture, fostering growth and adaptability. The number one thing that we hear is, how do I keep pharmacy technicians? So retention is incredibly important, and getting people in to be a pharmacy technician. If there's no career growth, what are the chances that somebody's going to stay in that role, right? They're going to go to an employer that has the opportunity for growth, whether, horizontally, vertically, diagonally. There's a new term out there called career lattices, which I've talked a little bit about, which I think you can, imagine what a lattice looks like, and working as a pharmacy technician can go that way. Like, you can go sideways and up and down and across. And this is one employer's excellent example. So, as I mentioned, they're a community pharmacy in Richmond, Virginia, and there's a comprehensive training program for each of these advanced roles. And then PTCB certification is required. So they have compounding technicians, they have an immunization specialist, which is Merity, who I talked about. There's an inventory management technician, medication therapy management, biometric screening, and technician supervisor. The next one I want to talk about is Beth Israel Leahy Health. This is in Boston. Investing in pharmacy technician brings a lot of value to our business. They are truly the backbone of our operation. I was a technician for 8 years before I became a pharmacist, so I know how much work they do. We couldn't be successful as we are without our technicians. So this is a health system in Massachusetts, hospitals, ambulatory clinics, retail pharmacy sites, and more. They have comprehensive technician career ladder. They have many advanced roles. They have 20-plus job titles for pharmacy technicians. So what is really great about, if you imagine what that lattice looks like, is all the different areas where you can go as a pharmacy technician. And I know this is a large health system, so it's not always going to be applicable to everybody's practice setting. However, one thing that is really great about this is that 20-plus job titles, what they did was, instead of saying Pharmacy Tech 1, Pharmacy Tech 2, Pharmacy Tech 3, Pharmacy Tech 4, Pharmacy Tech Supervisor, they called out individual roles of what those responsibilities were for each pharmacy technician too. So now there's like a Pyxis technician, right? So automated dispensing cabinet. That person specializes in that. But previously that was a Technician 3, and they were lumped in with all the other Technician 3s who were doing very many other things that weren't Pyxis related. So this is twofold. It benefits the pharmacy technician career lattice that they use, and then it also makes a better case to HR for wage increases, because now you can say, I have a specialist in this area, Pyxis for this example, and now the HR department does an evaluation of that role and what's required of that role, and they say, oh, actually, this specialist is worth more. So they get a raise, you know? So it's twofold, and they did that, and that's just one easy example. They did this, as you can see, with 20-plus job titles, because they called out specifically what those pharmacy technicians were doing, and it allowed a reevaluation of what the HR was describing, or, you know, in the job descriptions. They also have sterile compounding specialist, immunization specialist. They have pharmacy buyer, many leadership opportunities in the inpatient and outpatient areas for them, and then 340B specialist. And then here is University of North Carolina, clinical shadowing. So this is really new. The objective is connecting pharmacy technicians to patient care to improve pharmacy technician retention. So what the University of North Carolina found was that pharmacy technicians were really interested in how their work was impacting the end result of the patient care. And basically it was, for using an IV room example, that technician made that IV. They knew how it worked, but they didn't know anything else about the patient other than the name and the time of delivery, right? Like, that's it. That's where the patient care stopped for that person. So they implemented this program to allow pharmacy technicians to do clinical rotations, or clinical shadowing, I guess you could say that. It's not really rotations, but you're doing clinical shadowing to learn more. And really, if you think about that, we as technicians, I know I would have appreciated this opportunity a lot working, because when it's just an IV bag, it's just an IV bag. And you have to talk yourself out of that, right? Like, it's not just an IV bag. There is something there's somebody's life that's impacted on the end of that. So this was directly in response to ASHP retention survey indicating contribution to patient care was an important factor in remaining with an organization. So it's really expensive to hire new people, no matter if you're pharmacy technicians or buyers or in grocery stores, you know, baggers and clerks. Like, it's really expensive if somebody quits and you have to hire somebody else to train them and go through that whole process. So retention is really important for every single employer, whether they're having a hiring issue or not. They want to keep who they have. So this was an excellent example. And now we've seen a number of other health systems implement these types of clinical shadowing experiences for pharmacy technicians. There's even a Mount Sinai I think it's Mount Sinai in Los Angeles, has a clinical residency for pharmacy technicians available. It's only been around for about 5 years, but it's the first of its kind. And it kind of gives me chills to think about, because, like, I mean, we are, like, even though we're not making clinical decisions and making, you know, professional judgments around clinical decisions, like, we still are clinicians. Like, we're making medicine, and we're, you know, delivering it and filling prescriptions and all that stuff. So I think this is great. I'm really excited to see where this goes. I'll go through these assessment questions relatively quickly. I think everybody has them, right? So what?
You're doing great. on
Okay,
time.
okay, cool. I definitely want to have time for questions and answers too. So true or false studies have demonstrated that specially trained pharmacy technicians can perform technician product verification as accurately as pharmacists. Excellent. Assessment question 2, how many U.S. states jurisdictions require pharmacy technicians to be registered or licensed? 49 is the correct answer. This is registered or licensed. I did hear a couple people say 17. That's for this one. How many seats are employed at pharmacy are allotted for pharmacy technicians, which now this is out of date. This is 18. Exactly. All right, and then what is a common form of advocacy for pharmacy technicians within the pharmacy profession? This is relatively easy. All right, and then, oh, this is the one that I couldn't read to you, so I'll just give it to you. It's 65.9 is the answer. What percentage of COVID vaccinations were performed by pharmacy technicians in the state of Ohio? All right, so now questions for me. Yes?
Okay, going back to that list of different advancements, how do we find out what ones or what things we have to do to get those advanced, that specific advanced training?
Oh, so the list that was on there wasn't PTCB credentials or anything like that. Those are just examples of advanced roles for pharmacy technicians. But if you're talking about the assessment-based certificates, like PTCB does have assessments for some of those, not all of them, but you can find those at ptcb.org/credentials on the PTCB website. Is that what you're asking for the training that?
Yeah, in a roundabout way, yeah.
Okay, okay. Hands, questions? No?
Any other questions?
Cool. All right, thanks, everyone. Oh, yeah.
So, in the part where you talk about examples where in some organizations, they have differences in specialties for the technician. For example, where I work at, we do have that difference, but the differences are not in names. Everybody is technician, but several compounding technicians are at a higher pay. Is there AP? So, like you say, there was in one example there wasn't Tech 1, Tech 2, or whatnot. Is there a way for us to advocate for our organization to make that difference for the titles?
Yeah, for the title, yeah, definitely. I mean, it does come back to advocacy, right? So advocate. I guarantee you somebody in your workplace is looking at career ladders and retention. I would be very shocked if they were not thinking about it. So I guarantee you there's somebody you can talk to, like the pharmacy manager or somebody like that, that is thinking about it, and you could say, why don't we call them what they're doing, like name their job titles over what it is. And they may have thought of it, but if not, then you get that. Yeah.
So I was just gonna say too, so I, probably a year and a half ago, I was working at a cancer center here in town, and I was kind of at the top of what they had for pharmacy technicians as far as like being a clinic lead. And I actually went to my pharmacist supervisor and I said, I want to stay here. I really love this place. Like, what can I do to grow? And he said, honestly, if you can come up with things that you think we need here, we'll see about it. And so we created a pharmacy inventory position, which I took over. And then I actually left and just came here to Nebraska Medicine to a brand new position too. So new things are coming, and I'm actually a clinical
Excellent.
pharmacist.
Yeah, see, it starts with a conversation. Like, just ask the question. Like, I mean, just bring it up. Somebody's thinking about it, I guarantee. And if there's nobody there to take action on it, they might lean on you for that. And if you're up for the responsibility, like, I think it's a great role for pharmacy technicians to be a part of that conversation. And then you left, but you opened doors for other pharmacy technicians, right? Yeah. Thanks, everyone. That's okay. Oh, sweet. Oh, yeah, definitely. Awesome. Thank you very much. That's great.